In this video, I'm going to show you how to set up a plate for blood typing. First of all, you're going to need to get all of your equipment. You need a plastic tray with wells to put the antibodies and blood in. You're also going to need one of each of the antibodies. They're labelled and are different colours so it's easy to identify them. You'll need anti-A, B and D. You'll also need a bottle of saline, a watch glass, and a glass stirring rod. First of all, you need to set up the plate. Take your antibodies and carefully add 2 drops of each to the wells in triplicate. You need to do this for each of the 3 antibodies that you've been given. Anti-A, anti-B, and anti-D, which binds to the rhesus antigen. Once you've set up the plate with the antibodies, you won't need them again, so you can set them aside. Now we need to set up the watch glass so that we can dilute our blood sample. Take the saline and add 15 drops to the watch glass. This will be enough to dilute your blood sample and give you enough fluid to add to each of the 9 wells on the plate. Now everything's set up, we can carefully take a blood sample. Just as before, the side of the thumb or the forefinger is a good site to take the blood from. You're going to need a swab to clean the area and one of the safety lancets. Take the swab, open it, and carefully swab the area that you're going to take the blood sample from. In this case, I'm using the side of my thumb. You need to make sure that you let the area dry before you take the blood sample. If not, the blood will smear and it will be difficult to get a spot. Carefully remove the plastic cover from the end of the needle and press it against the side firmly. Press the plunger and you should hear an audible click. The safety lancet immediately goes into the sharp spin. Gently squeeze and release until you get a big bead of blood on the end of your thumb or forefinger. Once you've got a reasonable spot, you can touch this to the watch glass. Make sure that you don't touch the fluid and instead tip the watch glass so that the blood mixes with the saline. In this case, I only have a small drop of blood, so I'm going to get 1 or 2 more to make sure that I have enough blood for the practical. If you're bleeding more significantly, 1 spot might be sufficient. Once you've spotted the blood on, use the glass stirrer to mix it in with the saline. You're looking for a pinky colour to the water. Once you've finished, and you're satisfied that you have enough blood in your sample, you can get rid of the watch glass stirrer. This needs to go into the washing up bowl, because we don't dispose of them and instead clean them. Take a tissue and stop the bleeding on your thumb. Tissue and the waste swabs go into the clinical waste bin. And at this point, you should put gloves on as you're working with blood, and this is potentially hazardous. Take a plastic Pasteur pipette and carefully add 1 drop of your diluted blood to each of the wells that contains antibodies. The plastic pipette can be disposed of in the yellow clinical waste sack, and the glass watch glass again goes into the washing up bowl as these are reused. Carefully rock the plate to mix the blood with the antibodies and agitate the mixture. You then need to start the timer and wait for 5 minutes before you can look at the antibody. After 5 minutes, we need to take the plate and see if we can see any reactions. Stop the timer and carefully lift the plate and tap it gently on the sides. This will encourage the antibody and blood aggregates to form. These should be visible as small grains of sand at the base of the well. After you finish with your plate, you must make sure that you dispose of it in the washing up bowl. You can then remove your gloves and place these into the clinical waste vat.